Good evening. A Lac La Biche man has been identified as the victim of a homicide in Fort McMurray. RCMP say the body of 28-year-old Leslie Paul Laboucan was found inside a motel room on Sunday. An autopsy confirmed the cause of death, but details are not being released as the investigation is ongoing. The Prairie North Health Region has notified 7 patients, this after they learned some instruments were not fully sterilized. The medical procedures were done at Meadow Lake Hospital. The board says the risk of the patients contracting infection or disease from the instruments is extremely low. Now, they say the instruments were disinfected but not sterilized, which is the final step in a 4-step process. An internal investigation has been launched. The Alberta and Saskatchewan governments are working on a new health services plan for the border city. The cost-sharing agreement between the two provinces was established in 1999. Alberta Health Minister Fred Horn says it's time for the two provinces to update the agreement for Lloydminster. It will focus on addressing healthcare cost-sharing, long-term care services, and common standards for facilities. The working group will meet in early April to develop a new proposal. Newcap News will have more on this story tomorrow. Well, the Alberta government is cutting money used to improve programs for kids in care. Beginning April 1st, the province will no longer be providing quality enhancement grants. Kim Smith explains how this cutback will affect families in the border city.
And this money is very, very important.
The board chair of the Family Day Home Association in Lloydminster says eliminating the quality enhancement grants is a huge hit to its budget.
We operate day to day, month to month, basically breaking even. So these funds have been used to enhance.
He says the $7,500 per year was used for things like field trips, craft supplies, toys, and Christmas parties. The grant money was also used for training and to meet new standards the province put into place a few years ago.
So the government says, you know what, we expect you to have a higher level of training. Oh, but we're going to take the money that we were giving you to help you get there.
The Alberta government says it decided to spend the $7.1 million previously earmarked for the grant to protect childcare subsidies for families earning less than $50,000 a year. But Public Interest Alberta says because the subsidy was put into place last year, most families in that situation would have already applied for it.
The minister's communications people, I think, are spinning not a very accurate tale when they talk about this grant no longer being necessary. It is very necessary.
Bill Moore-Kilgannon says it doesn't make sense to cut the grant, considering that Human Services received a boost to its budget for childcare.
If childcare had taken a cut like other aspects in the budget, I could understand this. But as we said, they actually slightly increased the budget for childcare. So why are they going ahead and removing this quality enhancement grant?
The local Day Home Association says it's not sure how it intends to make up the money, whether it be through fee increases or fundraising. It's parents who end up paying for it in the end.
We have to find that money, which is not going to be easy. $7,500 in a year is, quite a significant amount of dollars.
Kim Smith, Newcap News.
Maidstone RCMP is looking for suspects responsible for stealing thousands of dollars worth of copper cable. It happened sometime between February 21st and 26th at a lease site in the RM of Britannia. Police say the suspects unraveled a large roll of cable and fled with approximately $15,000 worth of product. Now, there are no identifiable marks on the copper cable. Anyone with information is asked to call Crime Stoppers. Well, it's time to lace up your sneakers for a good cause. The 15th annual Enerflex Multiple Sclerosis Walk is less than a month away, and organizers are concerned about the lack of walkers. Bart Pediasek catches up with the Lloydminster MS Society and gets a first-hand look where the money raised will go to.
Dee Johnson was diagnosed with MS 15 years ago. While constant treatment has helped her, it's still something she lives with every day.
Over the course of the years, I've had several major attacks, everything from optic neuralgia, which leaves you blind for a while, and losing the use of my legs, and a lot of pain and muscle problems.
People like Johnston are why Lloydminster puts on the Enerflex MS Walk every year. Last year, they raised more than $170,000. This year, their goal is $190,000. And with the fundraiser a month away, the MS Society says they're concerned with the lack of registration. They have less than 200 people on board so far.
This tends to be a trend year over year. People, I think, tend to wait until closer to the event, and sometimes the weather conditions outside don't exactly get people thinking about a walk.
Green encourages people to register early as it gives more time for fundraising.
When people sort of use the weather as a crutch, I like to say put things into perspective. For a person living with MS, they cope with challenging days all the time.
Money raised will fund MS research and local programs. Johnston says it's programs like that that got her through the bad days.
As far as I'm concerned, they saved my life because when I first came here, I couldn't use my arms very well. The muscles were seizing up. Same with the swimming, and now I'm 90% functional with all my muscles.
To register you or your team, visit their website. The MS Walk takes place April 27th at Bud Miller Park. Bart Pediasic, Newcap News.